And I also want to give another shout out to you and the NBA, because I think the restarting the season was important to us as a society. Everything, of course, as you well know, and our listeners know, was shut down, and we did not have the usual distractions, and people were worried. And so I have to tell you that I always say, and I've said this to you personally, that the NBA really, I think, helped our country get through at least that early phase of the pandemic. So just let me thank you on behalf of a whole lot of people. So talk a little bit about the bubble. Because a lot of sacrifices were made by the players, staff, coaches, everyone. So how many people were in the bubble? And tell us a little bit more. I think we saw it from the outside. We know you were at Disney, and a lot of people think, well, being at Disney isn't all bad, but tell us a little bit more about the actual bubble.
We started with a very short runway. From the time we suspended our season March 11 to the time we agreed with the National Basketball Players Association to move forward with resuming our season. And we had to consider all aspects of the bubble. First and foremost was going to be the physical and mental health of anyone who would be there, and the way to operationalize a bubble and make it livable. If we were going to be there for a few months, it not only had to have the essentials in terms of testing and masks, PPE, and all of the things that we needed to help make people safe. But if we were going to do a closed campus, we needed to consider the fact that we couldn't send people out. So we needed to have as much as we could in. And that included having an on-site medical clinic, imaging resources. We had to make sure that it was livable so that people had opportunities to exercise, to take walks, and to have fun. We were going to be there for months on end, and it couldn't be all work. To do that, we had to think about not only the medical, but the social, the emotional, and we had lots of stakeholders who were there. Of course, we had 22 teams and their coaching staff and team staff. We had NBA staff. We had media, we had broadcasters, and all the people who were there to help us operationalize the plan, from transportation to food and beverage to activities and on-campus excursions. So it was a lot of collaborative effort. It was not just medical by any means, but medical was intertwined in all of it. If we were transporting people from the hotels to the arenas, we had to think about spacing and ventilation. If people were going to eat, we needed to make sure that there was physical distancing, and that we could do things in a very responsible manner. Even when we got there, we had people quarantine for a short period of time. And how could we make the quarantine not too onerous on people? And after that, testing every day, getting people to be compliant with the protocols. We had to think about how could we harness technology to be able to remain compliant, make sure that people were testing and we weren't missing anyone. If someone did test positive, that we were able to follow up with them quickly to abate any transmission. So it was a massive, massive lift, lots of collaboration and lots of meetings to make sure we stayed on top of everything. So the events group met, the medical physicians we met with the athletic trainers every day. We had a testing meeting twice a day to go over the results. We met constantly to make sure that we didn't drop the bubble. And from time to time, we would bring everyone together virtually to provide updates. This is what we're seeing, this is where we are, and this is the next step. To the best of our abilities, we made sure that we kept things safe with an eye on the future, so that if we were going to have this livable, workable situation, what would it look like if we were to allow players to bring their families down? And could it not just be for the people there working, doing business, but for kids? So the bubble was its own unique period in time, its own experiment, its own experience, and a lot went into it to make sure that we did it the right way, to really make sure people were healthy, were safe, but to trickle in some enjoyment in the experience as well.